My name is Savannah Lodwick, and my presentation is on cardiovascular disease in African American men. Cardiovascular disease is an umbrella disease that consists of strokes, heart valve problems, heart attacks, or any other serious heart issues. Heart disease remains the #1 cause of death in the United States and has for several decades. In fact, 1 in every 4 deaths in America are due to cardiovascular disease. To put this into an even more frightening perspective, a person dies every 36 seconds from cardiovascular disease in America. A population that is at high risk for cardiovascular disease is African American men. African Americans alone are around 30% more likely to die from cardiovascular disease than non-Hispanic white Americans. Within the African American population, male cardiovascular death rate is 271 per 100,000, while women's is 169. That's a huge gap. Not only are African American adults 40% more likely to have cardiovascular disease, but they are significantly less likely to have it under control in comparison to white Americans. Cardiovascular disease, although the primary means of death in the U.S., remains the #1 cause of death in African American men. Cardiovascular disease is very prevalent among African Americans. In fact, 46% of African American men over the age of 20 have cardiovascular disease. Not only do African American men have a high prevalence of cardiovascular disease, but almost half of the African American population has it. The high prevalence of cardiovascular disease within this population is partially attributable to the high prevalence of high blood pressure and hypertension seen across America. Symptoms that are associated with cardiovascular disease include chest pain, tightness, pressure, or discomfort, and sometimes these symptoms coincide with one another. Shortness of breath, pain or numbness in the legs or arms and jaw, neck, abdominal area, or back is associated with CVD as well. Typical treatments for cardiovascular disease focus on lifestyle changes, medication, or medical procedures or surgeries if necessary. Some lifestyle alterations include low-fat and low-sodium diets, moderate daily exercise, cessation of smoking, and limiting alcohol consumption. Environmental factors like pollution and occupational environments can sometimes increase the chance of one developing CVD. Social determinants of cardiovascular disease include access to healthcare, obesity, which is linked to social networks, smoking, low socioeconomic status, low levels of education, access to healthy foods, and food insecurity. Cardiovascular disease is seen at higher rates amongst minority men in the U.S. Some of the factors that account for this association are lower socioeconomic status and lower education status. These health disparities lead to lower access to healthier foods and less knowledge on healthy eating and living habits. Cardiovascular disease is the leading cause of death around the world, and in fact, in 2016, 17.9 million people died from it. This statistic motivated the authors of this qualitative study to review literature and find common factors in preventing CVD. This was done with an extensive literature review of 22 CVD-oriented studies. They looked for exercise, support, medications, and lifestyle modifications to find commonality among the studies. Patients with a higher education understood their treatment and care at a greater degree than their counterpart participants. Along with this finding, lifestyle modifications was not highly represented in the literature review, even though it plays a key role in cardiovascular disease management. The study that I found on quantitative data on cardiovascular disease focused on reducing African Americans' risk of developing it. The data collection seen in this study accounts for years' worth of quantitative data. The researchers of the study suggest that avoidable death due to CVD had progressively declined from the year 2000 to 2010, but efforts still need to be made to lower these numbers even further and prevent more cardiovascular disease-related deaths that are correctable. Current research focuses on the general aspects of CVD, but the focus really needs to be shifted towards the population most at risk, African American men. There is a mortality gap between white American men and African American men that can be shrunk if the proper research is conducted, and steps are taken to prevent further CVD development. The disparity between the two groups is alarming and needs to become a priority. Some studies have already called for more research on the matter. The primary level of CVD prevention consists of efforts to detect the disease early. Early detection of cardiovascular disease has caused a decrease in the death rates by 31% in the U.S. from the year 2001 to 2011. The focus of primary prevention in CVD is to assess what risk factors the patient has or has experienced. These can include obesity, hypertension, diabetes, lack of physical exercise, or family history of CVD. Secondary prevention for CVD is centered on management tools geared for asymptomatic patients. The goals of CVD secondary prevention are to enhance a patient's quality of life and increase their long-term survival. Medications like beta blockers, ACE inhibitors, aspirin, or statins can be taken to slow the progression of CVD. Tertiary prevention in cardiovascular disease consists of altering or slowing down CVD progression and can even attempt to reverse the disease. This can be done through coronary intervention, coronary bypass grafting, weight management, diet management, and tobacco cessation. Some of these options can be performed by the patient, but some are surgeries conducted by physicians. More research needs to be done regarding the gap of cardiovascular disease in white American men and African American men. This gap is preventable, and more research on how to lessen it needs to be conducted and implemented across the country to get this disparity under control. Funded through the CDC or the American Heart Association would be a step in the right direction to begin planning and implementing programs. These programs need to be centered on healthy eating and healthy behaviors. This can be carried out via education on healthy eating and physical activity in order to encourage communities to join the fight against preventable CVD progression. In regard to healthy food availability issues, local programs will provide healthy eating options in areas where families cannot afford healthy food. These next two slides are a long list of my references.